first day of vaccinations go for this group? Dr. Lesley Bamford, Acting Chief Director at the National Health Department, joining us now live. Thanks for your time. So any indication yet about the turnout? How's it looking?
So we started vaccinating today. I think as expected, it was a relatively slow start. By 4 o'clock this afternoon, we had vaccinated just under 7,000 children between the ages of 12 and 17.
So that's nationally?
Yes, those are the figures that we have recorded. So bearing in mind that obviously most of these children are attending school today.
Yeah.
So I think we expected a slow start, and we are happy with the start. There were no major problems encountered. We registered approximately 40,000 children, and approximately, as I say, just less than 7,000 children were vaccinated.
Yes, I guess it'll pick up in the next couple of days, right? So are you looking at then perhaps making this vaccination process easier by taking it to schools?
So for this year, we do not plan to be vaccinating in schools for a number of reasons, including the fact that we know that our secondary schools are now very focused on end-of-year exams. And we do not want to disrupt those examinations. We are talking to the Department of Education about the possibility of vaccinating in schools next year, but to date, no decisions have been made.
And of course, there's lots of hesitation, right? Some parents might not want this to happen, but their kids do. What do you say to those who say that, you know, they don't really need the jab in this age bracket?
So it certainly is true that COVID infection, as we all know, tends to be much milder in younger people, including adolescents. However, we know that during the third wave, we saw an increased proportion of cases occurring in children, particularly in teenagers. And there was an increasing proportion of admissions and some deaths in teenagers and other children. So the first reason is to protect the teenagers themselves. We also know that teenagers do transmit the infection amongst themselves, but also to more vulnerable older persons. And then importantly, we know that the COVID pandemic has caused major disruptions in school and has led to many children and teenagers missing out on education. And so we really need to be controlling, limiting outbreaks in our schools so that our schools can continue to provide education that our children really need and have a right to expect and enjoy.
Yeah, absolutely. Last question, and I know we put lots of focus on, you know, urban areas when it comes to vaccinating people. The department has tried to go further into rural areas in South Africa. For this group as well, it's very important to make sure that it's easily accessible. How is that unfolding?
So we do have some work to do ensuring that the Pfizer vaccine is available right across the country. As I'm sure you are aware, we have been prioritizing or trying to use more Johnson & Johnson vaccine in our more rural areas because it is a single dose, even for adults. So there is some work to do to make sure that Pfizer vaccine is available all across the country. But we also know that it is some of our rural provinces who have been achieving the best coverage. So we have vaccination sites right across the country. We are continually working to make the sites more accessible and to take the vaccine to people as much as possible. But as I say, there are vaccination sites right across the country. And so if teenagers want to be accessing the vaccine, it should be available.
Sorry,
just to stress that whilst the focus today is clearly on teenagers, we know that we need to encourage adults and particularly older persons, 50 years and older, to vaccinate, because they are the most vulnerable, but we are now encouraging everyone 12 years and older to vaccinate.
That was actually my next question. If you look at the other categories, are you still not seeing a big increase in people over the age of 50 coming through for vaccinations?
Well, we vaccinated more than 60% of people over 60 years and more than 50% of people over 50 years. So those are significant numbers. However, it still means that there are 40% of 60-year-olds, those 60 years and older, who are not vaccinated. And those people we know will be very vulnerable during any subsequent waves. So we would really encourage older persons, those 50 years and older, particularly those 60 years and older, if they haven't yet vaccinated, or if they've had one dose and still have a second dose outstanding, to visit one of our vaccination sites and to get vaccinated.
All right, thank you so much for your time. We do appreciate it, Dr. Lesley Bamford, Acting Chief Director at the National Health Department.